Welcome. This is Anita Karcz. I'm the Chief Medical Officer of the Institute for Health Metrics. Thank you for taking the time to join me today. This is our second episode of some instruction about the social determinants of health. And today I'm going to talk about the history of social determinants of health. I've introduced myself, but I'd like to introduce our organization, IHM. We are a not-for-profit organization, and are dedicated to helping hospitals with their mission of improving performance and reducing disparities. Now, the concept of social determinants of health, otherwise known as SDoH, was first gained wide recognition in the 1960s in US policy. But for decades before then, frontline health professionals have known about this. This is not new. This is something that healthcare providers have always seen. And the reality of disparities is clearly evident to anyone who's had hands-on patient care. And this, for myself, the first time it was evident to me was as a medical student between my second and third year of medical school, when I was part of a program where students from different health care professions were such as dental students, medical students, nursing students, went down to Appalachia, where we did different things in different communities. And my task was to shadow public health nurses in a particularly poor section of southwestern Virginia. And we would go into areas and see certain things and I was so impressed by what these nurses would try to do given the environment that they were working in. For example, how could you adequately take care of a diabetic ulcer that a patient had when there was no running water in the house? And that sort of thing really made an impression upon me. And every healthcare provider has a similar story, something that touched them about that reality. And this is what this produces poor health. And no matter how much technology we throw at that problem, we're not going to change the outcome. In the year 2000, Marmot and Richardson published a book called Social Determinants of Health, and they found many things. And this book actually is for people who are interested in this topic. This is very scientific, but it's worth spending time with. They found things like that about social determinants of health that people have really not systematically approached before. For example, that social position determined health. And when people change their social and cultural environment, disease risk changes. And they back this up with scientific evidence. And this graphic, which we'll go over a little bit more in the next slide, really illustrates well some of the principles that they brought to bear in this book. This is that graphic. And I think the key is this individual action. They call this health hazards. We would today probably call it health risks. And all of these, what we might call social determinants of health, frankly, the greater these are, the higher the slope of this line, and the more difficult it is for preventive action, and the greater these risks are. If you can lower these at all, you can actually shift the slope of that line. And when you do that, the preventive action is easier and the health risks become lower. And there's also some synergistic action. If you affect one of these, you will also help affect some of the others. WHO also looked fairly closely at social determinants of health. And a link to their report from 2010 is here. This diagram that is from that report obviously is pretty complicated, and I'm not going to walk through it in detail. I think the most important thing to take away from this diagram is here is where the healthcare system is. This very small part of the entire effect on equity in health and well-being. So I would encourage you to look more closely at this publication, which is easily available online, to dig into this more and get some of the thoughts from WHO about this. The health system contributes very little to some of these, to really our health status when we think about this. And I touched on that in our introductory episode previously. So thank you for joining me today. I hope you have joined us for our previous episode and our episodes to come. And our mission as a not-for-profit is to help hospitals with their mission to improve healthcare access and to reduce disparities. I'm glad to answer questions about what we do and also to answer questions about social determinants of health data and working with data to identify patients who need particular help and to identify initiatives that hospitals can work toward to help the community. Thank you. Please get in touch if you have questions.